Welcome aboard, ladies and gentlemen. Dr. Peter Glidden, your steadfast advocate for health. 844-374-5433. That's the number to call to speak to me live. 844-374-5433. I'm a licensed naturopathic physician. The letters after my name are ND, like Nancy Drew. In order to become a naturopathic physician in the United States, you need to do 4 years of pre-med, 4 years of naturopathic medical school. There are 5 naturopathic medical schools in North America. They are all fully accredited by the United States Department of Education. So 4 years of pre-med, 4 years of naturopathic medical school, about 900 hours of clinical supervision. Then you have to pass national boards, state boards, pursue continuing education credit every year in order to have a license to practice naturopathic medicine. Currently, 18 states only license and regulate naturopathic medicine, which begs the question, well, do the laws of science, mathematics, and physics change when you cross state lines? We do not have a free medical market in the United States. We haven't had a free medical market since the early 1900s. After the Flexner Report, which was sponsored by the Carnegies and also the Rockefellers, had a lot to do with the monopolization of medicine in this country. All forms of medicine besides what the MDs do fell by the wayside in the early 1900s. The chiropractors, the naturopaths, the homeopaths, the herbalists, the acupuncturists, they were all kicked off of the bus of medicine by the Carnegies and the pharmaceutical industry and by glad-handing legislators to pass laws which made it illegal to practice medicine unless you were an MD. This is a monopolization of the medical marketplace, and it has been so ensconced in our collective consciousness that we do not even look at it as a monopoly anymore. We think that every other type of medicine is substandard, right? We view the naturopaths as alternative. We view the chiropractors as alternative, the homeopaths as alternative. Well, this is tantamount to saying that the only real oil producer is Exxon, and every other oil producer is an alternative oil producer. The only real oil producer is BP. All other oil producers are alternative oil producers. The only real dog is a German Shepherd. Every other dog is an alternative dog. It's nonsense, right? But that's exactly what we think when we think about medicine. The monopolization of the medical marketplace has had more to do with money and power and virtually nothing to do with effectiveness of therapeutics, as is evidenced by the fact that MD-directed medical treatments are the leading cause of death in the United States, the leading cause of bankruptcy in the United States. And since the MDs have been in charge exclusively over the delivery of medicine, our life expectancy has gotten shorter, infertility has gotten worse, chronic diseases have escalated, no cure for cancer, etc., etc., etc. The worldview that the MDs are trained in, medical doctors are trained in allopathic medicine. They're not trained in medicine. They're trained in allopathic medicine. And the philosophy of allopathic medicine is that the human body is a bag of biochemicals waiting to break. There is no inherent spiritual force. There is no vital force. There is no intelligence inside the human body. The human body is a bag of biochemicals waiting to break that evolved by evolutionary fiat somehow. A passing thundercloud shot a bolt of electricity into a prehistoric swamp, and life started and then evolved. It's nonsense. But this is what the MDs believe. So when the MDs come up against a chronic health condition, when the MDs come up against an acute health condition, their intention is not to cure it. Their intention is to manage it because they don't think a cure is possible. Of the thousands of prescription medications that are currently available, the only ones that even get close to curing something are antibiotics. And now antibiotics are starting to have deleterious effects because it's the wrong dog for the hunt. An antibiotic produces positive results over here, but it produces negative results over here because it is an inappropriate therapy for the human body. It's just pounding a square peg into a round hole. It's going to have negative effects. Antibiotic-resistant bacterial infections are going to be the epidemic of the next 100 years. But I digress. I want to talk this morning about cancer. You know, the way that the MDs are trained in medicine, the allopathic reductionistic method, makes them think in one way only. They think inside of a set of parameters, and they do not go outside of those parameters ever. Well, let's start thinking outside of those parameters. I'm going to give you just a little inkling here of a different way to think about cancer. This from internetwks.com. That's internetwks.com. The Cure for Cancer, Theory, History, and Treatment. The Cure for Cancer, Theory, History, and Treatment by Owen Fonoro, 2003, internetwks.com. Check it out, internetwks.com. Here's what he says. The theory that malignant cancers are false placentas, that's interesting, was first formulated by the Scottish embryologist John Beard in 1902. Beard found that substances secreted by the pancreas would inhibit the growth of cancers before they develop. But these substances are missing in the blood of cancer patients. These substances, digestive enzymes trypsin and the trypsin precursor chymotrypsin, reportedly digest 100% of fast-growing cancers when taken orally at an extremely high dosage. This author has found evidence that it may be possible to achieve the same cancer digestive effect with lower enzyme dosages by enhancing trypsin's enzyme activity with certain nutritional supplements. John Beard was a brilliant biologist whose main research was pregnancy and the placenta in particular. He made or confirmed several crucial observations that led to his theory of cancer. He observed under the microscope that the trophoblast cells that form the placenta looked like cancer cells. Beard then made an extraordinary observation. The placenta stops growing on day 56 of the human pregnancy. On the same day, the fetus pancreas begins to function. He came to the conclusion that the fetus's pancreas secreted something that stopped the growth of the placenta. He then surmised and later proved that the same substance stopped the growth of malignant cancer. He set out to determine what this pancreatic substance was. Are you interested yet? You should be, because the MDs do not think like this. By the way, this particular theory of cancer, Beard's theory of cancer, got the wind knocked out of its sails. Beard's theory of cancer got the wind knocked out of its sail by the advent of chemotherapy, which was derived from mustard gas used in World War I. So, Beard conducted experiments with the juices extracted from young animal pancreases. These juices were injected into cancer tumors, and the tumors shrank in both animals and humans. Beard's work was published in JAMA, the Journal of the American Medical Association. Imagine that. And he wrote a book on enzyme therapy for cancer 100 years ago. Physicians tried to duplicate Beard's experimental results, but they failed, and the work was almost forgotten, and then chemotherapy was developed. We now know that delicate enzymes can lose their effectiveness if not carefully extracted from young livestock. Even though trypsin was one of the first proteins whose molecular structure was deciphered by chemists in the 60s, we are still not able to synthesize either trypsin or chymotrypsin. As pure trypsin must be extracted intact from young livestock, the cost of these supplements is high. The cost at the dosage recommended by enzyme cancer experts may exceed $2,000 per month, which is a pittance when you compare it to how much chemotherapy costs. We all begin our lives as a single undifferentiated cell. This cell is called a zygote. It's a sort of super stem cell, and it divides into trillions of progeny. Living cells change after succeeding divisions, but not all cells become muscle, bone, eyes, teeth, hair, connective, or other tissue. Some cells form into the placenta, a trophoblastic layer of tissue that attaches to the uterine wall during pregnancy, which is discarded by the mother's body after birth. Beard, the first to observe that placenta cells resemble cancer cells, also saw how malignant cancers act in the same way that the placentas do in the mother's womb. They attach to the uterus and eat through it to obtain a blood supply. Beard also found other out-of-place trophoblastic cells in great numbers throughout the body. These cells are placenta-like, do not differentiate into specific tissue, but lie dormant. Beard called these cells germ cells. They have properties similar to stem cells, and Beard believed that these cells are the seeds of cancer. Very interesting, don't you think, that this theory is completely overlooked? Well, there was a doctor in New York who was promoting this theory. His name was Gonzalez. About 2 months ago, he was murdered. Ladies and gentlemen, I have no idea what was going on with that, but he was having success treating cancer without chemotherapy. My point here is, outside of the conspiracy zone, that the viewpoint of disease that the medical doctors bring to bear is an old-fashioned, outdated, ineffective viewpoint. Your medical doctor is like a colorblind artist who does not know that they're colorblind. Their paintings are always going to be wrong. But because they exist in the monopoly, and because they have been trained to look down their nose at everybody who is not an MD, when their therapeutics fail, when their therapeutics harm, when their therapeutics kill, they're not going to change their methodology. There's too much cognitive dissonance there. For goodness sakes, you need to elect me Surgeon General of the world. I'd hire Dr. Wallach, and that's when real healing would begin. Marilyn's up next.
Dr. Peter Glidden here. Thanks so much for clicking on the link. I appreciate your trust and your curiosity. Last year in the United States, we spent over $30 billion on nutritional supplements, and everybody's still sick. When it comes to nutritional supplements, the recipe is everything. All wine is made from grapes. But there's a great deal of difference from bottle to bottle, depending on too many variables to count. It's the same with nutritional supplements. If you need to spend hard-earned money on nutritional supplements, which you do because medical insurance doesn't pay for it, did you ever wonder why? Well, that's the subject for an entirely different conversation. But in point of fact, our position is, in order for the body to work the way that God and nature intended it, there are 90 essential nutrients that need to be imported into it on a daily basis. These 90 essential nutrients are not all present in the food supply. You must supplement. It's mandatory. You must give your body the raw materials it needs every day to optimize its structure and function. You must give your body a fighting chance. So you need nutritional supplements. Well, which nutritional supplements should you take? That's the million-dollar question. I've been doing naturopathic medicine, practicing naturopathic medical therapeutics in clinical settings for over a quarter of a century now. And as God is my witness, I am here to tell you that the nutritional supplements which produce the most consistent, effective results are those developed and delivered by Youngevity. If you have finally snapped out of it and seen the light, if you are finally convinced that medical nutrition is what your body has been missing your entire life, and if you're ready to take a walk through the undiscovered country of science-based, clinically verified medical nutrition, then you need to try Youngevity's nutritional supplements because they produce the most consistent results of anything I've ever seen. And I've seen a lot in over a quarter of a century of primary care naturopathic medicine. Fill out the form on this page, ladies and gentlemen. Click the submit button, and a Youngevity representative whom I know and trust will be in touch with you to show you what to do to support and promote your body's ability to optimize its structure and function. Thanks for your time. Thanks for your trust. I am your steadfast advocate for health, Dr. Peter Glidden. Live long and prosper. I'll see you around campus.
374 5433 844 374 5433. Give me a call like Barbara in Maryland did, and let's see what's happening. Hey, Barbara, thanks for the phone call. You are live. Come in, Barbara.
Can you hear me?
There you go, Barbara. I can now. Thanks for calling. How can I help?
Okay, I have AFib and A-flutter.
Okay.
My doctors want to do an ablation, and to me, it's a dangerous thing for me to be doing.
Okay.
I have been on longevity. I started that in October. I still have I'm not seeing anything changing to stop the AFib. We're at a standstill right now. I have crazy pressure between my shoulder blades.
Yeah, I bet you do. Have you been to see a chiropractor?
I do.
And
he cannot understand why it is every time I come in that there's such stress there, he said.
All right, how much do you weigh?
I weigh between 145 and 150.
Okay, and what longevity supplements are you taking every day?
I've been taking the get it all here. Beyond Osteoflex.
Yeah, how much?
1 ounce before bed mixed with OJ.
Okay.
Also, the EFA, three a day.
Yep.
The Ultimate Selenium 6 a day with food. 2 for breakfast, 2 for lunch, and 2 for dinner.
Yeah.
And the glucose gel, 16 a day. 5 for breakfast, 5 for lunch, and 6 for dinner.
And what about the Beyond Tangy Tangerine?
I have been taking that. It was 1 scoop mixed with 14 to 16 ounces of water 2 times a day. But the gentleman, I can't remember his name, who recommended you for me to call and talk to you, thought perhaps I was having a reaction to that and told me to stop drinking it for a couple of days.
Yeah, okay, so you're not. See, this is the thing, right? If there was a fire in my backyard, heaven forbid, and I wanted to put it out, I would need to use water and not gasoline, right? Gasoline would make it worse. You need water to put the fire out. But if I used a squirt gun, wouldn't work. I would need a fire hose. I would need a lot of water to put it out. So when we are dealing with medical nutrition intervention for a physiological problem, we need to use the right stuff, and we need to use enough of it to produce a result. And we need to give the therapy time enough to work, because these therapeutics are supporting and promoting the body's ability to fix the problem itself, which is different than simply managing the problem with, strong pharmaceuticals. So, you take the Advil for the headache and 30 minutes later it's gone, but then 5 hours later it comes back. That's not really a cure. So you are halfway there, Barbara. You need to take a little bit more of a couple of different things, and you need to give the therapy a little bit more time. But there is something that you can do in the meanwhile here. I would get a bag of crushed ice, a Ziploc bag of crushed ice, big enough so that it can fit between your shoulders. I would attach the bag to the back of a chair, and I would sit down and rest your back against the ice. And I want the ice to be kind of right between your wing blades, okay? And I would do that 10 minutes on, 15 minutes off, 10 minutes on, 15 minutes off, 10 minutes on, 15 minutes off at night or during the daytime while you're watching TV or doing something relaxing. 10 minutes on, 15 minutes off, 10 minutes on, 15 minutes off for 2 or 3 hours. I would do that once a day for 3 days. Actually, in your case, I would do it twice a day for 3 days. Because we are of the opinion that most of the time atrial fibrillation is caused by an irritation of the nerves that come out of the spinal cord, which go to the heart and regulate the heartbeat. The medical doctors think it's the heart itself that's a problem. They're wrong. We believe it's the nerve that comes out of the back which is causing the problem, and we believe that the real root cause of this illness is something called degenerative disc disease. It's because the discs in your spine have shrunken and they're not as cushy as they used to be. We're up against a break here, Maryland, or Barbara, I'm sorry, from Maryland. Stick around stick around with me. I'll pick this up on the other side of the break and dial it in for you. I appreciate your patience very much. Ladies and gentlemen, I am Dr. Peter Glidden, your steadfast advocate for health. Stick around.
If you are sick and tired of feeling sick and tired, if you are finally finished with expensive and ineffective MD treatments, and if you are frustrated with not knowing which nutritional supplements to take, you have come to exactly the right place. We are here to help. Log into eiffelhealth.com, click the contact button, and someone who has been working with Dr. Glidden will contact you and show you exactly what to do to recover your health. Go to eiffelhealth.com. That's eiffelhealth.com and click the contact button now.
Welcome back, ladies and gentlemen. Dr. Peter Glidden, your steadfast advocate for health, talking to Barbara in Maryland. Okay, Barbara, have you done any of that stuff that I talked about before with the ice? Have you done that? Come in, Barbara. Come in, Barbara. There you go. Maybe you'll work now. Barbara, are you still with me? Hello, Barbara. Come on, Barbara. I know you're there.
I hear you.
There you go. That's better, Barbara. Okay, good. So have you have you done the ice thing or not?
At the moment, no, I haven't. I've been holding on the phone to talk to you.
No. I mean, but before you spoke to me, like
no.
No, okay,
no,
good.
I have not. That was not recommended.
Okay, so also, in addition to that, I would get a longevity product called CM Cream, like Charlie Michael, CM Cream, and I would apply the CM Cream to the same part of your back 4 times a day and immediately before bed, 4 times a day and immediately before bed. Now, generally speaking, when we do the ice and the CM Cream treatment to the mid-back, the AFib disappears within 72 hours, most of the time. I have over 100%. Well, so far, everybody that I've recommended do this with AFib, it's worked so far. So I would be surprised if it didn't work with you. But in addition to that, you need to increase your intake of some of these supplements if you're at 150 pounds. So in a perfect world, here's what you would do. The Beyond Tangy Tangerine, you would do 3 scoops a day. 3 scoops a day of the Beyond Tangy Tangerine. You would put 1 scoop into about 12 ounces of water, 1 scoop into about 12 ounces of water 3 times a day. The Beyond Osteo FX, I would like to see you do 2 ounces before bed, 2 ounces at night in a little bit of orange juice before bed, 2 ounces at night in a little bit of orange juice before bed. The EFAs, because of the AFib, I'd like to see you do 9 of those a day, 3 with breakfast, 3 with lunch, 3 with dinner. 6 selenium is good, 16 glucogel is perfect. So the only thing you need to increase here would be the EFAs, moving from 3 a day to 9 a day. The Osteo FX moving from 1 ounce to 2 ounces, and the Beyond Tangy Tangerine moving from 1 scoop to 3 scoops. I would do that for 4 weeks. I would do the ice and the CM Cream on and off for 3 days, and keep your fingers crossed and see what happens. Does that make sense?
Yes, I'll give it a try.
Okay, Barbara. I also did a webinar on atrial fibrillation. It's pretty good. It's a 45-minute long webinar. You can watch it on my website. If you are a Dr. Glidden advocate, you can become a Dr. Glidden advocate for $2 for 2 days, or you can get a month-long subscription for $20. Check it out, drglidden.com, and become a Dr. Glidden advocate and educate yourself about what we are doing, and specifically, right, what you can do for AFib and what we think is the cause of AFib, and by the way, what we think is the cause of asthma, arthritis, acne, etc. It's one-stop shopping at the Dr. Glidden Self-Help Health Recovery Advocate service, the Dr. Glidden Advocate. Check it out, glidden.healthcare. Let's go to Canada and talk to Shauna. Hey, Shauna, thanks for calling. You are live. Come in, Canada. Are you with me? Hello, Canada. Maybe now. Canada, come on in, Shauna. Are you there? Hello, Shauna. Oh, Canada. Oop, that's a dial tone. That's not working. I don't know, Shauna, why that didn't work. We're going to have to move on to somebody else. Thomas in Iowa has a question about his wife. Hey, Thomas, thanks for the call. You are live.
Hey, Dr. Glidden, I was talking to you on Monday, but something happened at the end of the show.
Oh, that's right. I'm glad you called back. We lost the signal. Yeah, we lost the feed. I'm really glad you called back, Thomas. Refresh my memory, please.
Okay, I'm on the program, and my wife is ready to start, and I kind of need to know what to give her. I didn't know if I was going to be able to talk to you today, so I went ahead and ordered some stuff. But let me give you her rundown.
Great.
She is 300 pounds. She has knee and hip joint problems. She's high blood pressure, weak bladder, and she had a hysterectomy, but one ovary is still there.
Okay, great.
That's
all right.
That's
So
about it.
very good. So these things, with the exception of the ovary thing, are all arms of the same octopus. Arthritis, hypertension, and bladder problems, these are all related to connective tissue and mineral deficiencies. And the best way to do this, now at 300 pounds, right, in a perfect world, she would do 3 healthy body, bone, and joint packs per month. 3 healthy body, bone, and joint packs per month, and 3 bottles of plant-derived minerals a month. 3 healthy body, bone, and joint packs per month, and 3 bottles of plant-derived minerals a month. That's the best place for her to start. Is she taking blood pressure meds right now?
No, she is not.
Okay, so she needs to get a blood pressure cuff, and she needs to take it to the firehouse, and she needs to get the EMT guys, when they're not out on a call, to check her blood pressure with their equipment, and then cross-reference it with her equipment and see if her equipment is dialed in correctly. And then she needs to get into the habit of taking her blood pressure once a day. I recommend people do that at high noon. Take your blood pressure at noon every day. Write the numbers down. And the upper limit of normal, as far as I am concerned, is 140/90. 140/90. That's the upper limit of normal. And for hypertension to be clinically diagnosed, in my opinion, you have to do the readings. Both numbers have to be above 140/90 3 times in a row. Both numbers have to be above 140/90 3 times in a row in order for hypertension to be diagnosed. So I would gainsay that the blood pressure would be the first thing to resolve here. So 3 healthy body, bone and joint packs per month, 3 bottles of plant-derived minerals a month. Eliminate the 12 bad foods, of course. Keep your fingers crossed and let me know what happens. Does that make sense?
Yes, it does. And I have one more question.
Okay, shoot.
Did you happen to read the November 9th, 2015 Time magazine?
No, I did not. What did it say?
Well, on the cover, there's 2 pieces of bacon crisscrossed. And if you flip to the inside page where it says cover story, it says, according to the World Health Organization, red meat, processed meat causes cancer. And right below it, there's 3 juicy hot dogs. And it says right below that, hot dogs are now considered carcinogenic.
We're right again, right? We've been saying this for how many years? It's telling people
a long time.
A long time, telling people to avoid meat that has nitrates injected into it. Correct. For this very reason. You know, interestingly enough, years ago, 17 years ago, Dr. Wallach was telling people this. Dr. Wallach was also telling people that margarine was bad and that butter was good. And last year, Time magazine comes out saying butter is good, right? The whole saturated fat thing was a scam. And now nitrates are bad, and Dr. Wallach again. You know, honest to God, Dr. Wallach should get some type of scientific congressional Medal of Honor as far as I'm concerned. But because of the monopolization of the medical marketplace, even when things like this come out which exonerate Dr. Wallach, you know, there's not going to be any traction there. There's not going to be any press except inside of our own community. It's a crying shame. I appreciate the heads up on that, Thomas. We like to think that we are ahead of the curve. And ladies and gentlemen, you know, the truth will out. We've been telling people for decades to avoid meat that has nitrates injected into it. We've been telling people for decades that salt is good. We've been telling people for decades that butter is good, that margarine is bad. And what do you know? We are right. again. Sandra in Virginia is up next. Let's see what she has to say. Hey, Sandra, thanks for the phone call. You are live.
Hi there, Dr. Glidden. I have a question about my sister. She's 73. She's a vegan, and she weighs about 100 pounds. She does have scoliosis, which she's had all her life, but it just looks worse now because she has osteoporosis. What can she do with the longevity products to gain some weight?
Well, the first problem that she has is that she's a vegan.
Right, I know.
And telling vegans that they're incorrect is really difficult. It's like telling a Roman Catholic that their reincarnation is real. It's just not going to fly. So what she needs is bone and joint support. And most people think when we're trying to give bone support, we just got to give calcium and minerals and the stuff that makes the bones hard, right, and gives them structural integrity. But the minerals are laid down upon a matrix of cartilage, and it's like a little, it's like a spider web of cartilage that's inside that the minerals are laid on top of, like a skeleton, kind of, sort of. So when we are attempting to help people with bone health, we don't just give the hard minerals, we give the matrix stuff as well, and the matrix stuff would be the glucogel. So the recommendation for her would be 1 glucogel capsule per 10 pounds per day. So if she's 200 pounds, right, you divide 200 by 10, that's 20, and she would need 20 glucogel a day, and you divide that by 3, so give her 7, 7, and 6, or whatever, right? That's how you do the glucogel dose. I would also give her 1 bottle of plant minerals per 100 pounds of body weight per month, 1 bottle of plant minerals per 100 pounds of body weight per month, and 1 Healthy Body Start Pack 2.0 liquid per 100 pounds of body weight per month. That's a really good place to start. I would have her do that for 4 weeks, and then I would have her continue to do that while she does weight-bearing exercise, because weight-bearing exercise puts stress on the bones. The bones will then strengthen themselves after the weight-bearing exercise, but only if they have the nutrients necessary. So if she were to start doing weight-bearing exercise now, she'd actually hurt herself. But once the body's nutrified, when she dials that in, she should be good to go. Does that make sense?
Yes, that makes sense. Now that's one capsule 3 times a day of glucogel?
No, one capsule per 10 pounds of body weight per day.
Oh, per 10 pounds of body weight. Okay, yeah, got it.
Okay, got it. Yeah, good. All right, okay, now, the other thing you're going to have to do is convince her to do that. Right?
Okay. Well, I don't think she'll have any problem. I think the glucogel may be, tell me what's in it. I mean, I'm trying to think. Is it not vegan then? Huh?
Yeah, no, not at all. But what are you going to do? You're going to have to just keep your fingers crossed and see what happens.
Well, if she lived with me, I could just say, here you go, take it.
Even better. I won't tell if you don't.
I
All right, Sandra, thanks for the call. Best of luck to you very much. Larry in Nashville is up next. We have a minute and a half left, more or less. Let's see if we can dial this in before the commercial break. Hey, Larry, thanks for the phone call. You are live.
Hey, Dr. Glidden. This is I actually spoke with you in the chat room, and I was telling you about taking antibiotics. The doctor gave me the worst type of antibiotics ever.
Oh yeah, quinolone.
And I was on it. I was on the medication for 2 weeks, and I really didn't have any problems. Every now and then, I would have. It would be difficult for me to breathe, but I have asthma.
What were you taking the antibiotics for?
For cellulitis.
Oh, cellulitis. I get it. All right, stick with me, Larry from Nashville. On the other side of the commercial break, we will dial this in. Ladies and gentlemen, thanks for tuning in and turning on. I am Dr. Peter Glidden. Check out the website, glidden.healthcare. Welcome back, ladies and gentlemen. Finishing out the show today with Larry in Nashville. Larry, so you got cellulitis, Larry, and they put you on antibiotics. What happened to the cellulitis?
Well, I actually have sinusitis, not cellulitis.
It was what?
It was sinusitis for my sinuses. They said I had a sinus infection.
Oh, sinusitis. Okay, good. So what happened to it?
Well, it did get a little better, and I cleared it. But I was mostly concerned about the side effects of the antibiotics.
Well, so I get it, but there's not a lot that you can do. I mean, you can't, if you're exposed to radiation, right after you're exposed to the radiation and you walk away, well, there's only so much you can do, right? Because the damage has been done. So what we recommend people do after they take antibiotics is to go on probiotics. So you need to be taking probiotics into your body every day to put the good bacteria back into your digestive tract that the antibiotic presumptively killed. Because, right, the antibiotic is an indiscriminate killer. It kills good bacteria, it kills bad bacteria, it kills everything. It's like napalm. So you want to put the good stuff back into the body. And so Youngevity has 3 ways to do that. You can do the Flora FX. You can do the root beer belly. And you can do the nightly essence. You can do all 3. I mean, and which one is more effective? I have no idea. I don't think anybody can answer that question, quite frankly. I would perhaps do the nightly essence before you go to bed, and I would do the root beer belly during the day. I would do two packs of the root beer belly twice a day for 21 days, and I would do 3 of the nightly essence before bed. 3 nightly essence before bed. 2 packs of the root beer belly twice a day, and I would do both of those for 21 days. I would also go online and get this product called NasoPure, NasoPure, NasoPure. It's a little bottle with an alkaline solution that you dump into the bottle and fill it with water, and then you squirt it up your nose. It's a nasal rinse. And, there are many cultures in Southeast Asia that rinse their sinuses out every day the same way that we brush our teeth. And if you have a sinus infection or are prone to sinus infections, then I would get into the habit of doing the NasoPure rinse once a day. It's really easy to do. Fun. I don't know if it's fun, but it's interesting. But I would do that if I were you. NasoPure, NasoPure. Give that a run and see what happens. Make sense?
It does.
All right.
Can I ask you another question before we leave, though?
Yeah, go ahead.
Well, the final question that I have is that the side effects on this class of antibiotics is horrible. Like, people actually end up becoming disabled because of it. And I was wondering if had any idea of the likelihood of somebody who took this medication having that type of side effect.
No, I don't. Somewhere there are statistics, and the side effects of drugs are based upon the dosage and the amount of time that a person's been on it, right? So it's kind of like alcohol or like tequila, right? Like if you have 1 shot of tequila, maybe not so bad. But if you have 20 shots of tequila, well, that's going to be a problem. And it's the same with the antibiotics, right? If you're taking 1 shot of tequila just once, no problem. But if you do 5 shots of tequila a day for a month, well, it could be a problem. So I would believe that the net negative effects of the antibiotic would be just that. They would be net negative effects based upon how much of the stuff you've been taking and for how long. But listen, those negative effects are generated in people whose bodies are undernutrified. So when you have eliminated the 12 bad foods and you have given your body all the nutrients that it needs every day with the 90 essential nutrients that beyond the Healthy Body Start Pack, the plant-derived minerals, the essential fatty acids, the calcium, when you're doing all the right stuff in the right amounts every day, your body is going to be a lot stronger than the next person's body, and ostensibly you should be able to handle the stress of life, which in this case includes the antibiotic stress, better than your neighbor. So I would guess that you would be in a good shape here as far as being able to avoid any of the net negative effects. But what this means is don't eat the 12 bad foods and continue taking your Youngevity supplements every day. I appreciate your support. Ladies and gentlemen, go to glidden.healthcare for more information. God willing and the creek don't rise. We'll see you tomorrow. Till then, live long and prosper.